So diagnosis of diabetes is really important. It crops up many times in the AKT exam, so you really need to know this very well. The first thing is when you're diagnosing diabetes, it depends whether the patient is symptomatic or asymptomatic. For symptomatic patients, a diagnosis of diabetes is based on a random blood glucose of 11 millimoles per litre or more. If it's a fasting sample, then a diagnosis is based on a level of 7 or more. The Royal College have mentioned that candidates have struggled with glucose tolerance tests. If you look at the glucose tolerance test, then a level of 11.1 or more millimoles per litre is diagnostic of diabetes. This is in a symptomatic patient. If the patient is asymptomatic, then you need another reading on another occasion. Most people are familiar with diagnosis of diabetes in most patients, but gestational diabetes is different and the thresholds are different. So if you look at a fasting blood glucose for gestational diabetes is a level of 5.6 or greater. A 2-hour postprandial glucose of greater than 7.8 is diagnostic of gestational diabetes in a pregnant woman. Diabetes can also be diagnosed on the basis of the HbA1c level. The threshold level is 48 millimoles per litre. So a diagnosis is made if the HbA1c is greater than 48 millimoles per litre. But you should remember that a level of less than 48 millimoles per litre doesn't exclude diabetes. Now, there are a few exclusions from diagnosing diabetes using the HbA1c. It's not used in children and young adults, and it shouldn't be used in type 1 diabetes. Because this is a measurement over a longer period of time, then you shouldn't use it for patients who've been symptomatic for less than 2 months, or if they're severely ill or taking medication that affects the blood glucose, such as prednisolone. The HbA1c method isn't used in the diagnosis of gestational diabetes, and in very rare instances you need to bear in mind patients with genetic conditions that may alter the HbA1c.